comes out. But what happens here is that we have an impact, and the bowel is getting rid of whatever's around it. So all the liquid fecal material come around the impaction and come out as liquid diarrhea. Just because you have diarrhea, don't think you have an impaction, you got to run to the doctor. But it's one of the things that we'll see. Someone hasn't had a bowel movement for quite a while, and then they start having diarrhea, and the first thing we think of, okay, we have this issue. And we do our assessment and x-ray to follow. And then malabsorption disorder, and so forth. You can have different issues. You can have Crohn's disease. You can have any kind of colon issues where you're not able to retain or absorb. It just pushes on through. You will have diarrhea. Stress and anxiety is always our friend that causes a lot of things. Anti-diarrheas decrease hypermotility, so we're slowing down the peristalsis of the bowel so that whatever fecal material comes down, it can sit there and gather, water is pulled back off into the body, and then we have our formed stool. When you have increased peristalsis, what happens is that all the fluid part of that stool, which is supposed to be drawn up by the body, by the way, is not. It just comes out. So we have two problems now. One, we have diarrhea, and we have all the issues that go on with that. But then number two, we have dehydration because the water that's supposed to be coming into your body from the foods you're eating is not. And we have that compounded issue. And generally, if you have someone who is very young or very old, they cannot tolerate that. It needs to be dealt with pretty quickly. The types that we have opiates, we have opiate-like, and then we have the other ones, absorbents and so forth, and somatostatin. Opiates, one of the most popular one we have is Lomotil. That is a very effective anti-diarrheal. Generally one dose of that and everything is done. It does have side effects, like any other opiate or opiate-like medication. It does have sedation or sedative effects. We have Imodium, which is an opiate-like agent. It is not an opiate, it's an opiate-like agent. It has the same effect. The nervous system, slowing down peristalsis so that the diarrhea is decreased. Decreased motility. The only issue is that opiates, we know, like morphine, that do decrease or cause respiratory depression and has to be monitored when given to kids or older adults. So we're trying to cure their diarrhea and we put them into respiratory arrest. Those things have to be monitored. Physical dependence. That's generally these things are not given for more than 2 to 3 days tops, and they're done. Generally, after 1 or 2 doses, the issue is complete. Okay, whatever is causing that, we're identifying such, and then we're just causing or slowing this down. What happens in any one of these medications, not only these but ones we're coming up with, is that if you use them for a long period of time, the body gets used to it, and then we'll expect that to be used to evacuate the body or to slow it down to where the body now becomes dependent upon it. Otherwise, you'll continue to have symptoms, so we have to be careful with that. We have the somatostatins used for severe diarrhea, specifically for cancer treatment. We have our friend Pepto-Bismol, kaopectate is the traveler's friend, I think. Wasn't that called at one time? But the action that it has, and to be able to, again, slow down and stop or at least slow down the peristalsis to where the fecal material can stay within the bowel. The water can be drawn off, and then it goes back into a normal state. And almost 100% of the time, once the causative agent is eliminated, then symptoms disappear. Whatever started it, when it is gone, they go back to normal. These are things in order to affect the bowel while this is happening. By either they're being treated or nature itself is taking its course and taking care of things. These help the body to maintain regulation or homeostasis as much as possible until it can repair itself. Nursing interventions. As you can see up there, avoid food and milk. That causes more. Again, avoid sedatives. If you're taking antidiarrheals, you don't want to be giving sedative medication on top of sedative medication. And usually, if the diarrhea persists for more than 48 hours and you're trying to treat over the counter and you still have, it's time to go in. Something else is going on other than you just got a nasty bug. The body tends to regain control of itself within 48 hours. Constipation. Number one cause of constipation, what is it? Sedentary is number two. What is it? Dehydration. Not enough water. Not enough water. So you don't have enough water, you don't eat your dark green leafy vegetables, and you don't get out and take your walk, you're going to be constipated. In a lot of long-term care facilities for the individuals who are bedridden or spend most of their time in wheelchairs or beds, they will be given a stool softener in order to prevent constipation because they aren't getting up and moving around even though they may be doing the other two. You need that third leg in order to make it more effective. So we have neurologic disorders that can cause it. We have side effects, medications, lack of exercise, insufficient consumption of fiber.
What does neurological disorders often do with causing constipation?
Well, because the bowels themselves work from within the nervous system. For example, if you have a deficit in you get injury to your back, let's say, and you damage the nerves in your lower back, it actually affects from about the rectum down, where you can build up and everything's fine, but you can't release because neurologically it is not allowing it to do so. Does that make sense? It's a good question. So laxatives, we have laxatives which are used to soften stool. We have saline laxatives, like irritants, bulk forming, and stool softeners. We'll go through them real quickly if we go to the next slide. Saline or osmotic, we have a thing called Go Lightly. I have no idea who named that, but when you take it, you do not go lightly. You go oftenly. But, for anybody over 50, or if you're getting close to 50, you have to do colonoscopy. The colonoscopy is nothing. You sleep through it, you get up, you go home. The prep will kill you. Prep will kill you. All this is for is to increase the peristalsis of the bowel and evacuate anything that's within the bowel itself. So hyperosmolar salts pull water to the colon, and it causes you to basically have diarrhea. Generally, Go Lightly is used one time. You don't do it on a regular basis. One time for generally procedures more than anything. Or if you have someone who's severely constipated without an impaction, they will use that as well in order to get the bowel evacuated. I think the worst case I had was a home care patient that was bedridden, and he hadn't gone in about 5 days. So the doctor said, let's give him a little go lightly. And we said, well, okay. And then after it was given to him, he was laying in bed, and we thought, okay, well, he'll go lightly. Well, he splattered all over the walls, the ceiling, the bed, the floor. We had a, you know, that commercial with the people coming to green run, they clean up all the messes.
Okay, that was really cool. I think it's something else.
I think we got a problem when I come out with that.
Because they games on them too. So it's
We have Dulcolax, stimulant,
you keep adding
increase peristalsis by your sensory nerves. You have nerves within your bowels are like barrel sensors. The bowel stretches, it says there's something in it, let's push it out. And then peristalsis happens, like a caterpillar effect. This one starts and the next one starts and it just pushes everything on down. This does it artificially rather than increase the bulk. All it's doing is it's telling these receptors there's something there, push, 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 and it increases peristalsis. Generally happens in 6 to 12 hours. A lot of them, if you look at on the TV commercials, they say take it at night. What was that one? It was medication. It was Dulcolax something. It's called DM. It said a DM and the PM will give you a BM in the AM. Bulk forming, Metamucil, our favorite, Fibercon in a second. That's a bulking. Basically, we take that with water. It's little crystals. It gets into your bowel. It just expands. If you want to know how much, put them into a glass and stir it up and leave the spoon in it. And then wait about an hour. You're going to be able to get the spoon out. And if you understand that you told the person, when you do this, make sure you drink plenty of water so it does not become an infection. The main component of Metamucil is psyllium. What is that? No.
fiber.
Yeah, you know it's a vegetable byproduct. You know what it basically is? Wood pulp. I wouldn't pay $14 for a bottle of wood pulp. Just go out in the backyard and eat dark green leafy vegetables in here. Fibercon is another one. That's a bulking agent as well. Again, you have the receptor within the bowel. Is that these things bulk up the bowel and activate your receptors and causes you to go. And that you are relieved of whatever is inside of your intestines. Administration, as you can see, is drink with a glass of water. You stir and drink immediately because it will, in actually less than an hour. Once you stir it up and leave it set, it hardens and you have started with that jello and eventually turns into a brick. Okay, so you drink it immediately and you follow it with a glass of water so it doesn't become a brick in your stomach or your intestine. Side effects, you have abdominal cramps because again we are causing a bulking agent and causing peristalsis, which could cause cramping. One of the other major side effects of this is gas. And then we have emollients like cholates. Again, lowers surface tension, promotes water accumulation in the intestine. It emulsifies and lubricates the feces in order for it to come out. Another way to do this is just by drinking mineral oil. When I was a kid, it was once a month. My mom had the biggest spoon I've ever seen in my entire life. She would fill that up with cod liver oil. And you'd have to drink that. It's a lot easier to drink water, take a walk, and eat your dark green leafy vegetables, and you won't have this problem. And then the use, we can see stool soft, prevent constipation. Also used for straining. Those individuals who had a previous MI or those who have had abdominal surgery, for example, is you don't want them to strain in order to evacuate the bowels. Therefore, usually this is used for that things flow readily, easily. You're not straining. You gotta think that when you are in a Valsalva maneuver, that's when you're straining. You're pretty tough in the Valsalva maneuver. What happens? Your heart stops momentarily, just for a split, not even a second. It stops. If you've had a previous MI and you got a problem with the heart to begin with, now you have a cardiac event. So you want to be careful of that. Laxatives, all contraindications, undiagnosed abdominal pain. You got stomach pain, they go get some laxatives. You got to figure out what's causing it first. You want to make sure you don't have some kind of disease where you're actually going to be irritating things more than if you just left it alone or saw other treatments. You want to be careful. Yes.
That's a good.
I have an answer.
People use colonics.
It does. And one of the problems is people who chronically use any kind of a stimulant or therefore in order to eliminate the bowels, the body itself becomes used to that and now expects it to happen. They can reset. In some cases, yes. In some cases, no. For example, you have someone who is afraid of constipation, so at least once or twice a day they give themselves an enema in order to evacuate the bowel. What happens is they're stretching the rectum when they're giving the water. And what eventually happens is that muscle becomes flaccid. And now to be able to evacuate the bowel, they have to have an enema.
But you have a really long chapter.
So you have to be,
Do I have one
these things are used on a very limited basis in order to resolve. Most often to be used on a regular basis, that just helps keep things from solidifying, so that things keep moving through. That's not an issue. We can start using stimulants and so forth for evacuation of the bowel, and you use it on a long-term basis, and you have short-term, generally, just to get things started while whatever's causing it can be alleviated. Well, there is a movie out, if you ever want to ask me about colon cleansing stuff. There's a movie out with Matthew Broderick years ago. It's called Wellsville. It's based on a true event, by the way. It's where they thought that the person's health was based on the content of the bowel. So what they actually did, they had an asylum up in New England to where the main treatment was daily enemas and colon cleansing drinks and diets and so forth, because if there's nothing in your colon, you're healthy. The problem is that when you do that, it washes bacteria and other things out of your colon which are needed. And now you set yourself up for a lot of other different problems. If you ever want to see the results of constant colon cleansing, it's something of a comedy, but it's based on a true story.
It's called The Road to Wellville.
The Road to Wellville, yes. You're welcome. It's not a bad thing if it's used on occasion. You get people who get obsessed with that. and I have to keep my colon. They say when I die, I'll have 20 pounds of stuff in my bowel. Well, part of that's crap. It is. Sorry, I didn't do that way. Anyway. You know, they just say you got fecal material in your bowel when you die. Well, of course you do, because everything stops. And there it is, you know. But that was the old, years and years and years ago, was common.
I just heard people going to clinics for 2 or 3 weeks for toxic cleansing, and that's basically what they're doing, and I'm thinking,
If you want toxic cleansing, eat your dark green leafy vegetables and drink lots of water and keep walking, and things just keep passing through and you'll be fine. Yes. Don't drink toxins. Okay. You're welcome. You need a break?
No.
How many more slides do I have? 11? 16. Okay, we'll go to the end then. We have what? I don't know if I added them.
You made everything.
No, they're two different.
Your shirt's pretty long. You only got 12 slides.
Well, before we move on, let me go ahead and take 10 minutes. Those of you who need a potty break to have.
One's for the next year. Did I? You didn't.
I did. I have the outlines. I just don't have the PowerPoints.
You have the outlines here?
Yeah, you see them? Can I what?
Can we make copies here?
I don't know. I've never tried.
One there for
What chapter?
Unit 16. Yeah.
What chapter?
49 and 50.
He doesn't have the...
Yeah, I got it. I got it.
649.
I got it over here.
Do you want to make questions, please?
Oh, see, I was thinking this outline. Sorry.
Oh, no, I don't have that one.
She's not listening.
I'm not.
No, you're right. These are the outlines. So you're right. I was just thinking.
I need you to come on and say outlines because she hasn't done that in a while lately.
This?
Yeah, the outline.
Like, because I
You haven't
just
been
did the
printing out.
outline.
You just been doing key points.
Yeah.
This is how you feel like.
Yeah, because it's just frustrating.